Ever wonder what motivates people to get plastic surgery? Did they regret it? What can we learn from the stories of plastic surgery patients? We're here to explore those questions and get some answers today with my guest, Paris Hall, on the Plastic Surgeon Podcast. Hello, my friends. Welcome back, and thanks to our listeners for the amazing feedback. We have had so much fun so far and look forward to more of your insights and suggestions. Please rate us and review us on Apple Podcasts to help us get you more content. On the Plastic Surgeon Podcast, we listen to real plastic surgery stories of triumph and pain from real patients and providers to further understand their motivations or why they would risk their life under the knife. I'm Dr. Sajan, and today my guest is the wonderful, fabulous, amazing Paris Hall.
Hi.
Hi, Paris. We are here to talk to you about your journey, how we came to know each other, the procedure you underwent, and how it affected you.
Yeah.
So, Paris, what procedure did you undergo?
So I had a couple of procedures.
Mhm.
I had the BBL with 360 lipo, and I also had the tummy tuck.
And how long ago was that?
I had it back in September, so it's been about 6 months now. Yeah.
And as we go into that, tell us, where are you from?
So I'm from Houston. I moved to Portland in December 2017. So I'm an Oregonian now, I guess. Yeah, but I'm really a girl from Texas in my heart.
Yeah, that must be a big contrast from Houston to Oregon.
Yeah, it's different, but I appreciate their differences. So,
yeah.
Yeah.
And your parents, were they from Houston?
So my mother is from New Orleans and my father's from California.
I see. And how did you end up in Houston in the middle of that?
College.
I see.
So I moved my dad moved for work and then I moved with him. So, I was still a minor, so I had to move with my father.
Yeah.
And then I ended up going to college out there.
And did you grow up mostly with your dad?
Yeah, I did. It was both my parents, but my dad was the one who was employed. So he got a job in Houston and I moved with him.
Got it.
Yeah.
And was your mom with you in Houston? Oh my God. So they were together.
Yeah. Sorry. They were both together still. But I say with him because the move was motivated by him.
Okay. What did he do?
He was a medical biller.
Oh, wow.
Yeah.
That's cool.
Yeah. He did that at home most of the time, but it was nice.
And did you have siblings?
I have one.
Yeah.
She's a teenager, actually. So
Really?
we have quite an age gap. Yeah. My mom had her later in life.
Are you close with her?
Yes.
That's cool.
I love her.
Is she in Houston right now?
No, she's at my house in Oregon. Yeah.
Really?
Yeah.
Wow. What made that happen?
So my mother, my sister, and we all lived together. We were living together while my dad was still living. My dad got sick with cancer, and so he ended up passing away. So we all decided to stay together. That would be what's best for my mom. Yeah, no, it's totally a part of life.
What kind of cancer was it?
He had small cell lung cancer.
That's tough.
It's aggressive.
It's very
aggressive. It's very hard to treat. But the end of it was beautiful, and I got to take care of my dad, which is what I always wanted to do. So that was really special that I was able to give him that before our time here ended together.
Yeah. How old was he when that happened?
58.
Wow.
Yeah, so he was a young guy still. To pass away is still pretty young. But we made it through. And so now my mom and my sister and we all stay together.
That's nice.
Yeah, it's really special.
It is. And you all get along pretty well?
Come on. We're girls. So it's, the guy who was the mediator between the three is gone.
Yeah.
So now we're having to learn how to communicate without him. So it's lots of hormones in the house frequently. But, we make it through. Yeah. We're good. We go to the nail salon and, everything's fine.
Exactly. Yes. I've heard that before.
We make up. Yeah, it's fine. Yeah.
And you went to college in Houston?
I did.
And what was your degree in?
Drafting and design. So I was more so in engineering. But when my dad got sick, I totally abandoned engineering. And now I'm actively pursuing healthcare. So I'm pursuing my degree in nursing because I want to be a nurse practitioner.
Oh, that's cool.
Yeah, engineering just wasn't enough for me anymore.
I see.
Making money wasn't enough. I needed to make a difference.
That's awesome. You pursued your initial degree in design?
Yes.
Correct.
Mhm.
And so is that engineering, or engineering was a separate degree?
So it's like a engineering subset. So basically, the way that nurses work with doctors, I work with engineers. They tell me what they want, I create it or do the design for it, and then
Oh.
they stamp it, and then it gets produced.
Oh, wow. That's cool.
Yeah. Yeah.
And yeah, you did that. And after Houston, did you go straight to Oregon for your job?
Yes. So Intel moved me out to Portland, and so I was working with them for a couple years, and then my dad got sick, and then I left.
And what did you do for Intel?
I was working in manufacturing, manufacturing the microprocessors. Just I don't. It's a big long title.
Got it.
It's not interesting, but manufacturing microprocessors is where we're gonna leave it at.
Got it. And that happened for 2 years, and your dad got sick, and you went back to Houston for that?
No, we stayed here. I took care of him, and then after he passed away, it kind of changed me, changed my goals. Watching my dad go through those changes, it made me realize that there's more to life than just making a lot of money. I want my time here to be meaningful. I want to impact others. And I want my job to be something that supports that. So that's when I left I totally abandoned it and went straight to healthcare.
So you felt your goals were more monetary because you wanted to get out and make it on your own and make it yourself.
I like my goals at the time when I was working with Intel and in engineering. It was just to make as much money as I possibly can, to have as many things as I possibly can. I wanted to be, that 20-something that we see now who has a lot of things and, a lot of money. And, that was my goal at the time. And to support my parents. And that's still a goal, to support my mother. But I want my life to mean more than just having a lot of things now or to have a lot of money stacked up. That's just not important to me, because that's not going to mean anything when I'm no longer here. Yeah.
I don't think many people would really understand that the way you do.
Yeah. Unfortunately for me, it took something very dramatic to kind of wake me up to that. But I feel now that I'm living a more purpose-driven life, and I'm very satisfied and fulfilled. Even though it came with a pay cut, I am very happy with making a difference every day.
That's
and
amazing.
With being nice to people. And what if I'm the only nice person they saw, I just really think that's really special. And so I really take great joy in that.
That's amazing.
Yeah.
One of the reasons, Paris, I love doing surgery, overall, one of my life purposes has always been impacting people.
Yeah.
Right. And that one of the reasons I really love doing cases, right, and nice people like yourself and others, is I get to change their life.
Yeah.
It's 3 to 4 hours of work for me on that table, but it's a lifetime of change for somebody else.
Absolutely.
And I personally couldn't think of any other way on how I could impact others than doing what I do.
Right.
So I really understand that and connect to it.
Yeah.
And when I came to Seattle to finish my training, I could have gone. My family does really well in Wisconsin. I could have gone there and helped manage the family business and done probably 3 to 4 times better than what I do here.
Right.
But for me, I didn't see purpose in it.
Yeah.
Right. What was the point of just doing that, working 9 to 5, make good money? What's that going to get me?
Right. So true.
A couple extra zeros doesn't change anything.
Right. That's so true.
I wanted to meet people, change people positively.
Yeah.
And then be there for their journey. Right. And that's one of the reasons I did the podcast. I wanted to share those stories with others to impact people.
Right.
I think a lot of people don't understand the value that you feel and fulfillment you can feel when you impact someone.
Right.
What do you think about that?
I just think it's really special and really powerful. There's so much division in our world now. And I think that when you impact someone in a positive way, it can be really special, and it can show you that we all are connected in one way or another. Somebody might not share my journey or even your journey, but we're all human beings. And I feel like it's just really meaningful to your journey individually when you're positive to someone else.
You know what I think about sometimes, and I want to hear what you think. I asked myself, why do I like impacting people? And I don't know if I have a great answer for that. Do you have an answer for that?
The only answer I can come up with, and I've asked myself that too, I was like, because I'm really careful about being like a negative energy. And so I'm like, is this like a secret negative about me that because I want to be this special person to other people? And so I really examined it. And the only thing that I can come up with is that it's just in me. I want to be positive to others. I want to make a difference. I want my life here to have meaning. We're only here for a very small time if we think about the time of the universe. And I want that time that I am here to mean something to someone else, as sort of a monument, like it's sort of
Mm.
the only thing that's going to live on after I'm gone.
Like your legacy, if you will.
Yeah,
Mm.
yeah. That that's the only thing I could come up with, though.
Yeah, people talk about living forever. I think one
Yeah,
of the ways you can live forever
yeah.
is by having others live with your impact,
Right,
right?
right, exactly, like, and I think where I got that from is I did not know how special my dad was to so many people until he passed away. Like, I never went through, like, my dad's phone or through his conversations with other people, but all of the people who were texting him and all of the people whose lives he touched and all the people who remembered him and were really saddened by losing him because he was so special to them. Like it just really spoke to me and showed me that there's so much more um, to our experience as being human than just gain while we're here. Um, so yeah,
I really believe that too.
yeah.
And so after you took care of your dad,
Mm.
or I guess, how were you supporting yourself when you were taking care of him?
Savings.
Mm.
Yeah, I made a decision that all of the time that I had left with my dad was going to be spent with my dad. I was not going to work. I was not doing anything else. I didn't care if I had to scale back on how I was living. I just wanted to spend that time with him. And so I used my savings. I was living heavily off of savings.
Mm.
Yeah.
And after that time went finished, did you go back to the workforce?
I did, but not right away. Um, After the time with my dad, actually, after his passing away, about a month or two later is when I had my surgery with you.
Oh,
And then
okay.
I took more time off um, to still heal and recover because I couldn't be my best self for my patients and for other people if I was not whole on the inside. So I took
Mm.
about 6 months off from just working and just to not only recover from surgery, but from the losing of my father, who was very important to me.
Mm. So
Yeah.
so after you went through that, you decide what made you think that you wanted surgery?
I thought about all the things that were holding me back from living my best life, my fullest life. One of those really was insecurity. Um, it impacted my personal relationships. Um, it impacted how I viewed myself every time I went to take a shower. It
Mhm.
just impacted my internal dialogue, well,
Mhm.
to myself every day. Um, and so I just got sick of it. Like, I got sick of making excuses for myself and, like, why I shouldn't do it because 'cause I'm so used to taking care of others. I didn't feel comfortable with doing this for myself. Um,
So, when you say like internal dialogue and like you seem to have a lot of insight in understanding your emotions.
yeah.
How did you get that?
I think experience and wanting to understand. From the time that I was a child, even until now, I've always been the why person. Why is this like this? Why am I like this? Why are they doing that? And so even for the ways that I act and the things that I do, I'm always like, why do I think that way? Why do I feel this way? And I really examine it. I don't just passively think about it. I really try to understand and get to the root of something.
And when you were thinking about your insecurities, do you mind sharing what were those?
So I have two little boys. Um, Surprisingly, when I got pregnant with my first boy, I was a one. So going through 9 months of pregnancy, I really got stretched beyond my body's capacity at the time. My stomach turned black and it was very itchy. And so after I delivered him, I had a lot of saggy, very loose skin. Like if I kneeled forward, the skin would kind of droop like I had a bag or something in front of me. And I just would try to hide it under shirts or, I would wear really tight spaghetti straps to try to keep it compressed. And then when I had my second baby, I decided I didn't want to have any more children after that. But I still had the skin. And I just would try to make excuses and, I'll just wear my pants higher or I'll just wear my shirt. I won't wear bikinis or I won't wear bathing suits at all. But I'll just have to deal with it. Yeah. So that was the biggest insecurity. And then I also didn't like my butt. I had very deep hip dips on the side. I still have cellulite. That's just my body. I've accepted that. But what I didn't like was the hip dips and that my butt, it seemed like rounder at certain parts and like kind of flat at other parts. It was a very interesting butt at the time. Yeah.
And when you started thinking about surgery, how did you start looking for providers?
So I was looking in Portland.
And you lived there, correct?
Yes.
So you came out of state from me.
I did.
Okay.
So I was looking in Portland, and some doctors, their tummy tucks just weren't up to my. If I'm going to pay the money, like I want it to be exactly how I want it. Some of the tummy tucks just were not something that I would feel comfortable with wearing. Being naked, being seen with it, I didn't feel like it was worth the price to be still insecure about my stomach. And then if they did do a good tummy tuck, they didn't do a BBL, or they couldn't do a BBL that was up to my standards coming from the lens of someone who lived in Houston. I expected it to look a certain way if you got one. Yeah. So I could never find the combination of the two until I looked for you and I saw you and I was like, oh, wow, I think this guy, like, I think he's the one. Like, I think he can do it. But he's in Seattle. And so I had to have a conversation with my family about coming.
And how did you run across my name?
I was just Googling. I don't think there was anything specific that led me to you. I can't think of anything specific other than me looking for plastic surgeons. And I started broadening my search from just Oregon to Washington. And yours came up as like the best doctor in Seattle or something like that. And so then I was like, okay, so let me see what the pictures look like. Let me see what his work looks like. And then I started looking at your Instagram and I was like, okay, this looks really good. Yeah.
So you told your family you were thinking of going out of state. What did they say?
My mom didn't say anything. She kind of just was like, oh, and she had that kind of wide-eyed sort of look. And then I told my boyfriend also, I was like, I think I want to do my surgery in Washington. And he was like, are you sure? Like, are you sure this is the one? I'm like, yeah, I think this is really what I want to do. And so then they were supportive after they saw how serious I was. But at first it was kind of surprising because it would be a drive and they didn't know how I was going to be being in pain, and driving back and forth.
Did anybody tell you don't do it, that, you shouldn't do this kind of work?
No, actually, none of them discouraged me. All of the people that I told were supportive of me. And I think the reason being is that I pushed it off for so long and they knew that I was really unhappy with it, but I never tried to pursue doing something about it. I think, to be honest, I think they were secretly fed up with me being sad about it and wanted me to do something.
Sure.
Yeah.
What do you think your dad would have said?
He would have wanted me to do it. He actually was sad that when he was living, he didn't have the money at the time for me to do it. So he would have wanted me to do it because he tried to make it happen before, but it just didn't happen. He was the only person that I would really talk to privately about it. Like, Dad, I just wish I could do something. Yeah.
Were you closer to your mom or your dad?
Oh, that's tough because they're different. So
Mm-hmm.
my dad, I would say my dad because I'm more like him. The
Mm.
way that I think, the way that I engage with other people, it's always kind of, I would say it's more like him. But I do have aspects of me that are aligned with my mother as well.
Mm-hmm.
Yeah.
Mm-hmm. And then you booked the consult, right?
Mhm.
That was pretty straightforward to do.
Yes.
And when you came from the consult, how did it go?
I think it went really well. I was really informed afterwards.
Mm-hmm.
I was really happy with the price and everything that I was given. Um,
Was
and
it
I
more? Was it more or less than what you saw in Portland?
so for me to have all of the things that I had done, it was slightly less.
Hmm.
I would have only been able to get the PBL and the tummy tuck, but the lipo, it would have just maybe been like my stomach, but it wouldn't have been
Mm.
360, and I still wouldn't have had the look that I wanted to have after the surgery. And it still would have been more. And so it was like, I don't really like that.
Yeah,
Yeah.
and two surgeries instead of one.
Right.
Yeah,
They wouldn't have done it. Yeah.
I don't know anybody in between here and in Oregon that does this in one surgery, tummy tuck
Yeah.
BBL.
I didn't, from my research, I wasn't able to find it. It was always presented as two surgeries. And working and being a mother, that was concerning because I'm going to have to take time off twice.
Mm.
I didn't like that either. But it was something that I was considering because I wanted it really badly at the time. But I'm glad I didn't have to go that route.
Mhm,
Yeah.
mhm. And when people have their consult, we go through the anatomy. I'll typically draw what I'm going to
Hmm.
do. We'll identify what areas we want to change,
Hmm.
and then you get your quote. And after that, you have the option of either booking right away or going home and thinking about it or doing whatever you want.
Hmm.
When did you decide to book?
So I called my mother. I didn't leave. I called her
Mhm,
when I was in the lobby, and I let her know the availability you had to do the
mhm,
surgery. And I asked her, how do you feel about this? Because she would be helping me with my boys and with taking care of me. And I was asking her, how do you feel about this? Does this work for you? And she was like, yeah, like let's do it. And so I booked this the same day when I
mm,
was here. I didn't want
mhm.
to leave because I wanted that spot. Yeah.
Oh, cool.
Yeah.
Yeah, and then when you went home, you must have been excited.
I was, and so it's so funny because when I went home, I still had some of the drawing on me, like some of the markups where you did.
Mhm,
And so I would stand in the mirror because this is when I still had a lot of the extra skin,
mhm.
and I would stand in the mirror and I would like pull the 2 areas together to see what I would look like, and I was so excited to
Oh,
see
cool.
how different I would look after surgery. So yeah, it was really nice.
And, I don't think many people draw their excision. I always draw
Yeah.
it at the console.
Yeah,
Did you have consults before me?
I did.
And did any of them mark for you what they were going to do?
No, he just kind of, like, did, like, a airline with his finger, and he
Okay.
kind of told me what he was gonna do, and another one of them, kinda the same thing. One
Mm,
of them, I didn't even actually get to meet the doctor, I just kind of met the doctor's assistant.
mm.
So, that was kind of off-putting for
Yeah,
me at the time, I was like, "I don't really know this guy."
exactly.
Um, so yeah.
Did the markings help you understand better what we were gonna do?
Absolutely, and because, like I said, I had a lot of extra skin,
Mhm,
so it was able to be pulled and tugged by me, so I was able to pull the areas together to see what my stomach would kind of look like with all of the extra skin gone,
mhm,
and I felt like that was really, really positive for me to get an idea of how much you can do and how little you can do,
mhm,
um,
mhm.
and so that was really, really good for me to understand.
Did you, do anything to prep for surgery day?
I did. Um, so I made sure that I stopped taking certain medications.
Mhm,
I suffer from migraines, and
mhm,
so I take a lot of Excedrin migraine, which has like aspirin and
mhm,
a bunch of other things in it. I had to stop taking that. And so in order to like make my migraines less, I stopped drinking caffeine.
mm.
I also stopped eating so much sodium in my foods to try to alleviate some of the headaches. Um, and then I also um tried to make sure that I was walking more.
Mm-hmm.
I just wanted to make sure my circulation and everything was really well. I probably went overboard. But this was my first time ever having surgery or ever going under the knife. So I wanted to try to do as much as I can for myself to be as healthy as possible.
Makes sense.
Yeah.
Did you ever wonder why this guy, aka me, is willing to do the surgery in one, but nobody else wants to do it in one surgery?
I did. And I was scared, actually. I was like, either he's really good or this is going to go really, really bad. Like that. I was like, I don't know, because everyone else is saying no, but he's saying yes. And I wanted a yes. And so I'm like, I don't know, either I'm making a really good choice for myself or I'm making a really, really bad choice. And so I kind of went at it with, I'm just going to give it to God. That's how I did. I'm just going to give it to God. It's going to be okay.
Yeah. And so what's the thought process, just to share it with you? So when you do a BBL, you need fat to transfer to the buttock.
Yeah.
A lot. And to do that, you got a liposuction.
Mm-hmm.
So most doctors will not liposuction the stomach when they're doing a tummy tuck. So they'll let that upper skin stay pretty thick. They'll just take a cautery or the hot knife and cut, lift the skin up, pull it down, stitch the muscles, and then call it a day. And then they'll let you heal, and then they'll come back and lipo and do the BBL. Oh. Or the other way they'll do it is they'll lipo everything first, leave you with more sagging skin, do the BBL, let that heal, come back in 3 months-ish, and then do the tummy tuck.
Oh, I see.
So, and the reason they do that is this. There's a old school, what I call old school philosophy, that if you liposuction the stomach and do a tummy tuck at the same time, the skin will die and they'll get skin death and necrosis. And I believe that's the wrong philosophy. There's newer literature, newer data, right? And I went in Colombia and trained with a lot of the guys who believe this after my US training. All my training was in the US, but I went after to do more learning. And that's where they really pioneer a lot of procedures because they can push the envelopes there for various reasons I won't get into. And those guys there were doing liposuction with the tummy tuck and BBL. And I was like, how are you guys able to do this? Everyone here in the US says, if you do that, the skin's going to die and it's going to be a nightmare. They're like, I just did it. Here's my post-op. No, there's no skin death. So what I learned is there is a way to do it.
Yeah.
Now, when you liposuction the same time, and I'll give my secrets away to all the plastics guys who listen to my stuff, but when you liposuction with the tummy tuck, you can lipo the whole stomach. I'll say it now, my patients in front of me, for those who don't believe me, is you have to lipo in a specific way with specific tubes in a specific pressure at a specific plane. So when you're liposuctioning, if you care to know, there's a pressure on how much negative vacuum is sucking the fat out. And if you have that very high, like normal liposuction speed, and you lipo the stomach, the skin will die, guaranteed. Don't ask me how I know. So basically, you have to keep that pressure about half of normal. And that becomes a very long and arduous process, especially if you're a little bit older and not as strong. And I mean, you gotta move your hand 4 times more to get the same amount of fat because, it's a tube you're going back and forth with. So that's one thing. So you got to keep low pressure. The other thing is when you liposuction, there's different layers of the tissue. So you can get those layers, but you got to start at a particular layer and then do it.
Yeah.
And then how you raise the skin is very particular in how you transfer the fat. So learning all those things from the people who did it in Colombia and reading and studying myself and then doing it myself helped me develop a way to do it.
Yeah.
So like now every week I'll do 2 to 3 tummy tuck BBLs.
Yeah.
Like minimum. It's really over the past 3 months, it's blown up. I'm shocked.
Oh, wow, that's amazing.
Literally.
Yeah.
And I think the reason for that is I stream it live.
Yeah.
So I'm like, okay, you don't have to believe me. I'm not here to convince anyone.
Right.
Just watch it live and then you decide. And patients are still coming back, right?
Right.
That's
so true.
Exactly. And so that's how I do it. And I've actually, my techniques always keep evolving. There's a newer evolution I'm working on. But so that's how you can do it. So the other guys feel that skin will die. And they're not wrong. If you do it the old school way, the skin will die. But if you do it in a more sophisticated, safer way, you can get the same thing done. It just takes a little bit more time and a little bit more effort.
Yeah.
Does that make sense?
Yeah, that makes absolute sense to me.
And I think one of the reasons you see evolution so slow in US plastic surgery is the people who train, like the people who train me, they're all very old school.
Yeah.
And you probably saw this in your consults, right?
Yeah.
The most famous people are the old school people, and the new people coming out just keep saying what those guys kept saying, right? They don't want to try anything new.
Right.
And the few new people in the country, there's probably 5 or 6 of them, and I put myself in the category, who are bigger names, are the people who are willing to safely learn and push the envelope in the right patient. Right. Like, for example, if I did the surgery that I did for you in somebody who was over 50, diabetic smoker, it would be a disaster.
Right.
Like, I wouldn't even offer it to them. Right. So you got to know who you can do what on and how you can do it. Right. And that's the only way you can get out of the cycle of just people being stuck in a rut.
Yeah.
And what happens is the old school guys, and there's nothing wrong with them, right? Who just keep repeating the same song and dance, they end up getting pushed up by new people like me. Rather than they wonder and get jelly.
That's so true. But I'm really grateful that you were willing to try it with me. I'm very pleased.
Thank you. Yeah. Thank you. And the one thing I share with you is it's something that I learned from other people. So I didn't come and start experimenting on my patients, right? Yeah. So
right. Absolutely.
I actually, when I was in Colombia, I actually did surgeries there.
Oh, that's cool.
So yeah. So that's how I learned some of the newer things.
That's really cool.
Yeah, it was fun.
Yeah.
I loved it. And so from that, you decided to book. And then you prepped with the things you told us. And then surgery day came. How were you feeling?
So scared. So scared. I've never gone under anesthesia before. So I was like, what is this going to feel like? Am I going to know what's going on? I should not have been watching National Geographic and all of those discovery shows, but I was doing that, and Wikipedia was not my friend, but I was still, I was still looking. And so I was really, really nervous. But it went really well. Best sleep of my life.
And after surgery, did you stay local or did you go home?
I stayed.
For how long?
We stayed for 3 or 4 days because I think my surgery was on a Friday.
So your post-op was Monday.
Yeah. So we stayed that whole time.
And then you came for the post. How was the pain?
So the pain during the post-op, it wasn't really bad. I had medication, so I was comfortable. I just had to be careful in how I moved and in what I did. The most difficult thing was because the hotel's bed was high. So the most difficult thing was when you don't realize it, but when you're going from like a laying position to standing, there can be some pulling. So I had to be really careful and really use my partner and the walker to get out of bed to go to the restroom.
I see. And when you came for your first post-op, you saw things. How did it feel?
To be honest, that time is a little spacey for me. I don't remember feeling anything other than I remember I still had like the binding was still there. I remember that. I don't remember feeling any pain or anything. I know my stomach was tighter. It had to be tighter from just having a tummy tuck. But there wasn't any like sharp pains or anything like that. I was just really sore. Just like really, really kind of sore. But the pain medication was really helping to deal with that. Yeah.
And after that, you went home to Portland?
Yes, I did. I went later that day, I believe. Yeah.
And your sister must have been excited to see you.
Yeah, she was.
What were people asking you when you were recovering?
No one asked me anything because nobody saw me. I just stayed in the house. My boys, they knew that mommy had just had surgery, but I was still in the house. None of my neighbors were seeing me or nobody because I was still in my period of taking time off from things. So I was just really staying inside. Yeah.
As the recovery kept going, what was tough about the recovery?
So the part that was really tough was that I did not know that I didn't like staying in the house so much, and that I didn't like not being able to do a lot of things for myself in the beginning. I didn't know that was going to kind of weigh on me emotionally. And I also didn't know that I, at one point, was having a response to taking my pain medication. But you are the one who actually picked up on that before I even knew what was wrong with me.
So that was at your 1 month post-op?
Yeah.
Yeah, I remember you came to clinic and you just seemed down,
Yeah.
right? And I asked you, I'm like, because I really try to be in tune with my patients, right?
Yeah.
Because once I do surgery for you, we're friends until you're
Mhm.
fully healed, usually
Mhm.
for life, right?
Mhm.
And I said, parents, I think I asked you, right?
Mhm.
Point blank, why are you sad?
Yeah, you were like, "What's wrong?
Yeah.
You seem down. What's
Yeah,
going on?" I was like, "No, I'm fine." And then I called, like, later on, like, "I am really
yeah,
sad."
yeah. And
Yeah.
and what did you feel was causing? What did we arrive to that was causing the sadness?
My pain medication. I was not used to, so by this point, my system was really clean, right? I stopped
Mhm.
taking caffeine, I don't do drugs, I don't smoke, I don't do anything. So the pain medication, I was having a response to it that was
Mm.
making me feel kinda down. And so we decided to stop doing the prescription and to just go with the Tylenol at that
Mhm.
point. And that was totally fine. That was the absolute right choice for me.
And then you started feeling better.
Yeah, I started feeling like myself again. I didn't know that I was down in the dumps because of my pain medicine. I started to,
Mm.
feel really weird, like, I don't know, it was a really, really weird way of feeling. I can't really describe it, but it's interesting that you knew something was wrong with me before I
Mhm.
knew, but I couldn't see it because I was in it, if that makes
Yeah,
sense.
that's the best way to say it I've ever
Yeah.
heard. Um, you said it felt different not being able to do things for yourself, and that weighed on you. How did it weigh on you?
So I'm really independent. I don't like
Mhm.
asking people for things. Even if you look at how long I waited to do the surgery, I don't really like uh, doing having others do things for me or like taking away money from my family or things like that to do something for myself.
Mhm.
So it was weird having to call my mom and be like, "Hey, mom, could you get me some more water? That I just don't want
Mm.
to have to do the work of getting up right now." Or I ran out of my nausea medicine. Could you run to the pharmacy and get it for me? That was challenging for me.
I see.
Yeah.
And how have things gone now? How do you feel?
I feel fantastic. I'm really so happy with my body. I don't have that negative self-talk anymore. That's really powerful and really special. I'm really comfortable with how I look in clothing. It's kind of guided my decisions and how I eat and how I live now because I don't wanna mess up the work that you've done.
Mhm.
Um, so I feel really, really great. My headspace is really, really good.
That's awesome.
Yeah.
And you started at a size 1 before any of your pregnancies.
Yeah.
And then, do you mind sharing with us how high your or what your size was at
Yeah.
in the middle of before surgery?
Yeah, so before surgery, I was an 8. I
Yeah.
think I was an 8, yeah.
What are you now?
So right now I'm a 4. Yeah,
That's
so I've
awesome.
I've lost quite a bit of weight since surgery, not because of you or anything, but just like the lifestyle changes I've made. Also,
Mhm.
surgery played into it too,
Mhm.
but it's impacted me mentally and what
That's
I wanna do.
awesome.
Yeah,
So
yeah.
if other women are thinking about this and wondering, should I do this? What would you tell them?
Do it. Do it. It's like it will be so good for you. If you're mentally struggling with your body and like how you feel about yourself, you have no idea how much that plays into your life. And if you make this choice, it's just going to move you in such a positive direction. You're the only you that you have. And so why not make your life a little bit better? I think it's a wonderful choice.
I
Yeah.
agree. Everything you say is so deep and so much meaning.
Oh,
Yeah, I really
thanks.
like it. Um, if you could go and when you look at your story and if you could do something differently, or if there's something that you wish you would have known before doing all this, what would that be?
I should do it sooner. I'm not being selfish and taking care of myself. Um, and that it's okay to not have like perfect celebrity body or like perfect celebrity skin. That's just not my journey. That's not my path. But I can have the best version of myself. I just need to do a little bit of work to get there.
That's amazing. The
Yeah.
one thing I would tell you, Paris, there's none of those people have anything perfect. 'Cause
Right.
a lot of them come to me, and I can tell you that to be frank with you, you look better than 95% of them.
Oh,
But
thanks.
beyond that, um, everything, the pictures and everything you see is Photoshop and
Yeah.
airbrushing. You got to remember
Yeah.
that. Like
Yeah.
for example, Kylie Jenner never shows her belly button. I'm not kidding. And if
That's true.
and if it ever shows, they always have it blurred.
That's so interesting.
And I'm not going to say why because I know the person who did something. Right? So we'll leave that out of it.
I have a nice belly button.
Thank you so much for being our guest today, Paris.
Yeah, thanks for having me. I appreciate it.
My pleasure. I've learned a lot. I know your ordeal will teach our listeners how and what to expect as they start their own cosmetic surgery journey. I appreciate your time and am honored to have you as my good patient, confidant, and I would say friend.
Oh, thank you, Dr. Sajan. I'm glad I had you, and I'm glad I got to meet you and go on this journey with you.
Thank you. Yeah. The one thing I always share with people is if you're in the process of getting something medical done and you want something, don't settle for an answer because it's convenient, right? I'm not saying that I do like to think I'm the best out there, but what I am saying is if you want something, whether it's a treatment for an illness or something aesthetic or very elective, search out there till you make sure you know the answer that you want. I would say search out there until you know you have an answer for the question that you're seeking. Sometimes the answer might not be what you like, but don't settle because people end up unhappy when they settle.
Right.
Like sometimes I'll have patients who want me to do procedures for them that I know that is not my cup of tea, right? Like when I first started, I was doing everything. Now I can tell you most of my work is all body work, right? So sometimes I'll have patients that will come for, asking for extreme facial work. And I still do facial plastic surgery, but I don't do as much. And I'll often refer them out. And I don't mind doing that. But sometimes a doctor who's willing to, quote, make it work isn't the best choice for people.
Right. That's so true.
Thanks for listening to the Plastic Surgeon Podcast. And please rate and review us on Apple Podcasts to hear more great content. For my live surgeries on Snapchat and my adventures throughout the week, catch us on all social media at Real Dr. Seattle. Damn well.